hydrocodone, which is a narcotic opioid. He's using morphine to control his pain. This is his spine. So modern medicine failed us here, and he ended up with this major spine surgery. And as you can imagine, it's extremely painful, right? He's a professor, he can't take narcotics. He's teaching students all day long. Well, guess what? We got him started on some CBD, CBG, and he's doing fantastic. He's cut his opioid dose in half, and he's reported that he has the ability to stand through his lectures. Before he'd have to sit halfway through the lecture. So these are the different types of success stories that we're seeing in my personal clinic, and I can imagine how many lives you guys are touching on a day-to-day basis. It's going to be fantastic. These are some of the things that I do on a regular basis, like PRP, stem cells, spinal injections, radiofrequency, pain pumps, joint injections, Botox, nerve testing. So I have a very large exposure and a large gamut of patients who are in pain or suffering, and I'm seeing excellent results with the CBD isolates. So what are his options, right? He can go for more surgery. He can increase the narcotic pills. He can use TENS, physical therapy, aspirin, bracing. He can have a sedentary lifestyle. Everybody here knows that that's not even an option, especially in my clinic. Nobody's getting a sedentary lifestyle. You can get a pain pump, spinal cord stimulator, stem cells, and then hemp. The next frontier is here. You guys have heard of the World Health Organization? Okay, great news for us in here. They just passed a motion to decrease the classification of marijuana. So instead of marijuana being illicit, they actually passed something just within the last 2 months that they're going to try to propose decriminalizing it at a World Health Organization level. So this is the World Health Organization puts us out for chronic pain, right? Well, guess what? There's nothing here under diagnosis. The first line should actually be CBD, CBG oil. You know, neuromodulatory natural medications, curcumin, turmeric, supplements. So I think we're going to see probably, I would say, within the next 24 to 36 months, we will definitely see a change to this and how they approach treatment of patients with chronic pain. And you know, the world is taking notice, guys. The world really is. These are some of the devices that I personally put in on a regular basis, and now that I have these other options with CBD, CBG, hemp oils, I anticipate doing less of these. But this is spinal cord stimulator and a pain pump. We actually implant the patient's body, and it neurologically blocks the pain. It's a complete tech item, and the stark contrast to CBD, CBG oil is completely. It's exciting to me that, you know, maybe we won't have to put these battery packs in people to keep them living their lives. This is CBD, the molecular formula for it. It's a diol. A diol is basically an alcoholic ring. And like I said, we have receptors in our spinal cord that can that are actually saturated with these molecules. And you may ask, well, if you have the receptor for it, shouldn't you be taking it? And so the next frontier is stem cells. All of you have heard about stem cells. So the stem cells that I do in my clinic are from the bone marrow. I use the human body's own stem cells to optimize healing. One of the interesting things about this is that hemp oil has actually been shown to increase potentiation of the stem cells. So instead of me just getting stem cells out, I'm getting big, juicy, ready to work stem cells versus sluggish stem cells. And as we age, that's a huge deal. If we can optimize our stem cells to keep our bodies and our health in a perfect condition, then we're going to have greater results with these treatments that we've been doing. Neuroprotective. Dr. Ron will talk to you guys tomorrow. I've reviewed this PowerPoint slides with him for his talk tomorrow. He'll talk to you guys about how CBD, CBG, the different diols, the different terpenes can actually decrease neuronal death in patients that have had strokes, traumatic brain injury, Alzheimer's prevention. So this is super exciting for the future. This is a healing response. It's something that we're looking toward the future because there's not a lot of studies out there that talk about spine, muscles, tendons with hemp oil. It's mainly neurocognitive. So I'm waiting for this, from this body of research to be published that will help us to really understand the maximum effect of these peripherally, like in the musculoskeletal system. There's something called the healing trinity. It's a scaffold, growth factors, and adult stem cells.